to. We're on your computer, your mobile device. Just head on over to SuperTalk TV. And I think you and I will agree that more options in healthcare is definitely a good thing. And new to Mississippi is TrueCare. And they've got some new leadership. And joining us today is Ashley Thompson. She's the new CEO for TrueCare. So welcome, Ashley.
Thank you, Rebecca. Thank you for having me.
It's good to have you in on this capacity. I'll have to say you are connected with the Miss Mississippi organization for so many years behind the scenes. They wouldn't know it, but you're always sending us our Miss Mississippi teen each year. So it's cool to have you in your, I guess, your day capacity. And
my real job, not my volunteer job.
Yeah,
Yes.
your real job. Okay, I love this. So how do you explain TrueCare to people who may have not heard it before?
Absolutely. Thank you. TrueCare is a provider-sponsored health plan that was started by Mississippi hospitals and health systems, and I created a partnership with CareSource, an insurance company, managed care company, out of Ohio. And so we've come together to create a unique partnership where providers that bring care to patients and payer meet to collaborate to improve health outcomes and to make a difference in Mississippi.
How long has TrueCare been here in our state?
So Mississippi True is how it started initially with the hospitals and health systems, and they bid on a Medicaid managed care contract in 2017, and then the partnership with CareSource came about in 2021. So TrueCare has been here since 2021 in its current form.
So,
but we haven't. We will not have members in the Medicaid space until 7/1 of 2025.
Okay,
so brand new, even though it's been here.
Still very brand new and sort of exciting. So what does it offer for, I guess, members that's different than other avenues?
Well, I think the important thing to remember is that we are Mississippians making these health policies, working with the Division of Medicaid, collaborating with providers to make sure that members have the education that they need to receive the benefits that are provided to them from the state, to address issues with providers to help them embrace their own health care. And we all hopefully will work collaboratively together so that we can improve health outcomes. And, I don't think any of us Mississippians like to be on the bottom of those statistics that we oftentimes find ourselves on. And so just working together to make sure that we can give the best for the state of Mississippi.
I think we can all get behind that. Ashley, how did you find your way or what inspired you to join TrueCare here in Mississippi?
Well,
or TrueCare Mississippi, because I guess there's TrueCares in other places. Is it TrueCare Mississippi, or is it like TrueCare in Mississippi?
Just TrueCare.
Just TrueCare?
It's like share.
I love it. Okay, TrueCare.
Yeah, so a little bit of a different path to TrueCare. I was a government relations specialist for the Mississippi Academy of Family Physicians. That's really where I got into healthcare. Learned a lot from those family physicians that are in the community, in the trenches with people, the first line of defense for mental health, physical health, just making a difference every day, and learned so much from that organization. One of the things that I learned very early on is that the providers really did not love managed care in Mississippi. They felt that their voices were not being heard. And when I was approached by CareSource in 2021 to consult with them on the bid for the Mississippi Medicaid managed care contract, I really saw an opportunity to take what I had learned from those doctors and put that into something new and exciting in Mississippi, and use that experience to change the way that we provide services here. And that was in 2021. We were awarded the RFQ in 2022, and then now, after some protest time and different things, we're finally at the go live point.
What does it feel like to be at this go live point?
A little surreal,
especially since it's taken so long.
I hear the Taylor Swift song. It's been a long time coming, constantly in my head. It's amazing. I'm very excited for the state of Mississippi, for the providers in Mississippi that have worked. They've put time, energy, money into this endeavor to make the outcomes better for Mississippians, but also to make their job easier because they have, I wouldn't want to deal with a ton of administrative burden if I was them either. And so hopefully we can break down some barriers to communication and work together just to create a better working environment for everyone.
So your role as Chief Executive Officer, CEO, what will you primarily be doing for TrueCare? I mean, obviously you're running the ship, but is it getting the word out? Is it connecting, making those partnerships, or trying to cultivate those? Kind of what will you be doing on a daily basis, Ashley?
That's it, just that. I'll be working with providers across the state to make sure that they understand that we are a resource for them. We don't intend to be a barrier for them. We want to be collaborative and work with them to rethink the managed care space in Mississippi. And so I'll spend a lot of time setting strategy, working through policies, and then also just being on the ground in Mississippi, meeting providers and working with our members. At the end of the day, I'm not somebody that sits behind a desk. I like to be out and about and really thrive on personal connections with people and want to have connections from, with our members to our providers and our community-based organizations as well.
Well, you've definitely shown your love and passion for just Mississippians in general, obviously with your longstanding volunteer work with the Miss America, which would be the Miss Mississippi sort of organization. Do you see that sort of an extension from that? Is just, I know it's two totally different things, but what's good for the goose is good for the gander, kind of sort of in terms of having these opportunities, keeping our communities healthy, and just giving back of your time, even if it's in a professional sense, to doing what's best for those around.
Absolutely. I tell everybody, at the end of the day, I'm a Mississippian, and I see the good in our state and want to promote it and want to have other people feel part of this amazing opportunity that is TrueCare. And it's very important to give back, and definitely view this as an opportunity to make a difference and give back to the state of Mississippi.
With sort of I guess right now with so many people having different mindsets about healthcare, it can be good, bad, ugly, all in between. Some are educated on it, some don't. Some just go with their own personal experience with their own, insurance or sort of providers. Are you finding it hard or easy when you start that conversation with either members or providers that, hey, here's a new way, give it a chance, like open lines of communication? Do you see people are open to something new, I think is what I'm trying to get at.
I definitely think providers in Mississippi are open to something new. I mean, obviously, this is a provider-owned plan, so you have the backing of providers anyway. We don't have any members yet. So, we're just working through the community engagement, trying to spread the word about TrueCare. Whether you are eligible through Medicaid to be on TrueCare or not, we just want people to buy into the concept of this is a new health plan and it's good for Mississippi.
And if people are more interested in it, Ashley, where do they go for that? If they're maybe there's a provider listening, this is the first time they're hearing about it, or maybe hearing about it, oh, you know what, I've heard about that, I need to find out more, or potentially could be a member. Where are we going? I know the effective date's you said July 1st. I got it right. I know it's like it's sometime when it's hot. Where can they go for more information?
Well, we have a website, www.mstruecare.com, and lots of information on there for members and providers. You can look at our provider listings and find a doc. Obviously, we're uploading new providers to that list every day, so working with providers all over the state to ensure that we have a robust network of providers so that healthcare needs are being met for our members. Our providers can see how to sign up. There's links and numbers to call, so lots of information there on the website.
So you're going to be very busy after July, but you're going to be busy in June too, because you're headed to Vicksburg for you were telling me the 11th or 12th summer in a row? How many summers in a row have you been to Vicksburg?
Oh, goodness.
No, you said you've been...
Yeah, so probably like 24 summers in a row to Vicksburg for the Miss Mississippi competition, yes, but this is my maybe 12th volunteering.
Yes. For it. And when do the girls arrive?
Girls arrive next Saturday. They'll be in Vicksburg all week, and the competition begins on June the 11th.
And then we'll have a new Miss Mississippi coming up.
Yep, June the 14th.
June the 14th.
Yeah,
That's
if
crazy.
everything goes right, that TV show works, we'll crown a new Miss Mississippi about 9:58 p.m.
And then you'll have 2 weeks, and you'll have new members coming on board in July the 1st.
Yes, a very busy June.
Well, once it gets up and going, Ashley, you're welcome back to give us updates along the way with TrueCare. But I encourage people to find out more about it. Like you mentioned, a new opportunity is always a good thing for Mississippi when it comes to health care. So congratulations on your new role, too.
Thank you so much.
All right, you guys stick with us. We got more for you coming up next.